All right. Welcome, everybody, to What's Cooking with Dr. Cook. I'm Dr. Allison Koch, the content editor for Foodguides.com, which is a place where people with acid reflux, GERD, IBS, and those following a low FODMAP diet can find all of their nutrition and food recommendations in one place. We are joined today by one of our Food Guides contributors, Dr. Ashlie Morrissey, to talk about all things Ozempic. And thank you so much for joining us today, Dr. Morrissey.
Thank you for having me. I'm glad to be here and talk about this hot topic, I think, that seems to be on everyone's lips. So,
A hot topic indeed. Yes, it is all over the place. It is a TikTok trend. It is talked on the media. It is all over, and I have a feeling that it is here to stay for quite a while.
yes, absolutely. I think this medication, this class of medications, is definitely here to stay. It's something that is, as you said, it's the social media, the talk shows. It's everywhere. It's what people want to know about. It's on everyone's lips. So let's dive in. So.
Yes, absolutely. And just to let everybody know that if you have any questions or comments during our talk, please feel free to drop us a comment. If you're listening to this archive in the future on YouTube, please, comment, and we will definitely answer those questions because there's a lot of information about this. In fact, Dr. Morrissey is writing a series of articles about these medications on foodguides.com, has a couple of them out right now. And there's just a lot to it. In fact, I think the best way to kick this off is to go ahead and just break down what the medication is. It's a part of a class of medications.
Yes. So I know we labeled this sort of, let's talk about Ozempic, but Ozempic, the active ingredient is semaglutide. And so when we talk about Ozempic, we're talking really about that active ingredient, which is what's doing the work, the workhorse in that. And so semaglutide is what's called a GLP-1 agonist. And the GLP part of that is a glucagon-like peptide. And so that's all science sounding, but if you break each of those words down, what they actually mean, glucagon is a hormone. Your pancreas makes that. Your pancreas is sort of one of those powerhouse organs in the body. It makes insulin. It helps us, break down. It's a big part of our metabolism. If you're diabetic, you probably have a lot of arguments with your pancreas, but glucagon helps regulate your sugar levels, helps kind of your metabolism. Peptides are something a lot of people aren't familiar with. Sometimes people go in the GNC and you may see protein powders that have the word peptide on them, but they're actually these little short chains of proteins that are a type of amino acid. And so they work as a type of messenger that help your cells communicate with each other. So they're a type of sort of communication, a way that cells talk to each other. And so the glucagon like peptide. So that's saying it's a glucagon like peptide, and then the one so receptor agonist is that it's initiating sort of a physiological response at the receptor site for that hormone in your body. So when we take this synthetic, because your body actually produces GLP-1, and it would be nice if maybe they had named the synthetic form of the drug something else, or just put maybe like a little A at the end so it was the artificial form of it, but they just named it GLP-1 because we have natural GLP-1 inside our body. And then we have the synthetic GLP-1s, which are this class of medication, which are slightly chemically different, all of them, which makes it just a little more confusing when you're trying to sort of figure all of this out and what it all means. But we have our natural GLP-1 that the body produces, and then we have the synthetic, GLP-1s that, the pharmaceutical companies have done the research, and that's what semaglutide is. And Ozempic and Wegovy, which is the other name that is has semaglutide in it, but its indication is actually for weight loss, whereas Ozempic is technically indicated for diabetes management. They both contain semaglutide. So that is the specific GLP-1 drug that is the active ingredient in both Ozempic and Wegovy. So I know it's a lot of kind of science-y, like nerd sounding stuff. But it's not, if you break it down and kind of break it down by each little individual thing, it's fairly easy to understand. It's and like you said, I did try to go into that in the article that I wrote because I think it's a lot. If you don't do this, if you don't deal with this stuff on the regular, it's a lot, you get into the body's metabolism, and that's just a lot to start to try to understand.
Right, exactly. Well, and I do think it's important to bring up the fact that, GLP-1 is something that, the body actually does make because that does simplify things when you're talking about like satiety. So, the feeling of being full, the fact that, you can make this naturally when you eat foods like fiber. However, the fact of the matter is when you eat foods like fiber, yes, it does increase your body's GLP-1, but it only does it for a very, very short amount of time, as opposed to when you take this medication, it's in your body for days. So,
Yes, yes. The lab engineered GLP-1s, they have, when we talk about medicines, we talk about the half-life of medicines and sort of what that is, how long they stay in your body, how long they stay in your body, and they're doing the work of what we want them to do. And of course, these lab created GLP-1s, they're staying around and they're staying active for much longer than the ones our bodies produce. So that's I guess the benefit of these lab created synthetic ones. So
absolutely. Well, in your experience, how effective has Ozempic been for patients specifically targeting weight loss?
so for weight loss, I think it's a very effective medication when you're talking about and you'll find I will use Ozempic, Wegovy, semaglutide kind of interchangeably as I talk about this because I find people do as well, depending on what they've been introduced to. But I find it's very beneficial. I think a lot of that is going into sort of expectations with people up front is that you have to sort of with any medication, you have to go into it knowing, having a conversation with your medical provider about what is the expectation, what is your treatment plan? If you're looking at this from a weight loss perspective, the indication for semaglutide is technically that you have a BMI over 30 or over 27 with a comorbid condition related to obesity. So if you think about, well, what does that mean? What is a BMI over, of 27? So if that's, I think, like someone who is 5 feet 6 inches tall, then that would be someone who's 170 pounds. And then they would need to have something like high blood pressure, obstructive sleep apnea, another medical condition that can be attributed to obesity. Or say if they were that same 5'6" person and they were 185 pounds, then they would have a BMI over 30. And so that's technically the people that semaglutide was FDA approved for. Now, of course, it's used off-label, like many medications are, for people who don't quite meet that criteria. But I think anytime you are going to be starting on a medication, you should talk with your provider about, okay, my goal is to lose this amount of weight. And, I think a good initial goal is 10%, because we know that if you're, unless it's more of someone who doesn't need to lose that much weight, of course, that's the caveat there. But for someone who is in that sort of obese range, 10% of your body weight has been shown to significantly reduce risk, of heart disease, diabetes, stroke, these significant, health risk factors. So even reducing your body weight by 10%. So having that as an initial goal, I think is a great thing, but having the discussion is the important part of that. And so what we know from the studies that have done some big analysis, large groups of people, is that if you look at that, about 66% of people taking semaglutide lose about 10% of their starting weight. And so that's a very attainable goal. But I think it's also having the expectation of knowing that this medicine is not, it's not a magic fix, that it has to be titrated up slowly, which means you have to start at a very low dose, which is for a lot of people not a therapeutic dose. So when you're starting at a low dose and then having to take that for, a weekly injection for a month, and then having to increase that dose, take a slightly increased dose for a month, you may not see that you're losing weight that first month, that second month. Those may not be the therapeutic doses for you. You may not see weight loss until you're in that third month, fourth month. And for a lot of people, that can be disheartening. And so that's a conversation, that's education that I think, you need to make sure is happening on the front end. And of course, that's a whole other conversation about, unfortunately, healthcare providers not having time maybe to educate patients like we wish we did. But I think going in, knowing that this is a medicine that works, it has, data that backs it up. Anecdotally, people, it works for people. But it has to have time to find the dose that works for people. It also does, it potentially can have some pretty kind of negative side effects. And so that's also a conversation that has to be had of, how to work through those side effects. Because if you're not able to work through the side effects, of course, you're not going to see benefits from it.
Yeah, I absolutely want to touch on those side effects. We do have a question from the audience right now, though. One of the audience members says, I'm old enough to remember fen-phen, um, which was a pretty significant uh, weight loss medication
Yes,
back in the,
right.
what was it, early 90s when it went off the market, was
I
it, or
think,
was it early
yes.
2000s, for
Um,
cardiac arrest, I believe.
and
Um,
pulmonary hypertension, and yes,
yeah,
cardiac arrest,
yeah.
yes.
Do you anticipate any potential long-term problems with these
Well,
semaglutide drugs?
so the GLP-1s have been on the market for a while now. I mean, they're not brand new. I mean, let's see, Trulicity, for example, I think is getting ready to go off patent. Um, that is maybe in another, I want to say, couple years. I mean, the GLP-1 class of medicines, they're not a new class of medication. And so there's not, we know there are, side effects. We know there are some things that we watch for, and there are some risks associated that we kind of monitor for. Um, and so that's the thing. And there are ongoing studies looking at, are these risks, for example, um, we don't prescribe this to people who have a history of a certain kind of thyroid cancer, because in sort of the preliminary, when we were still doing animal studies, we saw in the animal studies that this very specific type of thyroid tumor would grow. Now, I was just reading a study from the European that was done in the European Union that there have not been apparently any of this type of thyroid tumors in humans. And this is a big meta-analysis where they've looked at, everyone that's been prescribed this drug, and no, they couldn't find any of this specific type of tumor. And so it sort of begs the question, because, animal studies, they don't always translate into humans. And so, but it's sort of, I think, one of those, there's an abundance of caution, that's not always a bad thing. Um, but there's nothing, as far as like with Fen-Phen, that was a stimulant medication. And so we knew, even though we still use phentermine today, which was part of that combination medication, we definitely don't use phentermine for extended periods of time because we do know that phentermine runs the risk of pulmonary hypertension, irregular heart rhythms. There are risks associated with that. And so that's, I think all medications do have some risks, but we know that there are things that we have to monitor for and sort of take into account. But things like the big sort of, death, those types of, big things like Fen-Phen, no, there's nothing like that that seems to be showing up. And like I said, this class of medicine is not a brand new class of medicine. The new medicines that are coming out, like the semaglutide, like Zepbound was just, approved or given an approval for indication for weight loss, which was Mounjaro, or is Mounjaro, I should say, or tirzepatide. So these medicines, they're basically just taking the GLP-1, and they continue to kind of work with it in the lab and find these slight modifications of the molecule that make it work a little bit better, so but the actual, this class of medicine is not new, so it does give you a little bit of a sense of not having to be so concerned that some new strange long-term side effect is going to show up.
Yeah, absolutely. So one of the ways that, you know, people are losing a lot of weight on this medication is the appetite suppressant aspect of it.
Mm-hmm.
And would you consider that more of a mechanism um, aspect of the medication or more of a side effect of the medication?
Well, so I certainly think that it can be maybe initially a bit of a side effect, because I think initially there is a bit, I think a lot of people report that they experience some nausea when they first start on this medicine. But I think a lot of that is sort of unlearning eating habits, because one of the big problems that seems to trigger nausea and sometimes vomiting is, you're having to unlearn eating habits. And one of the things that really triggers nausea and sometimes vomiting is, because of the way the medication works, it delays emptying of the stomach and delays the movement of food through the GI tract. And so if you eat a very large meal that has a lot of fat in it, and that food sort of sits in the stomach, doesn't move very quickly through the GI tract, then eventually the body says, you know what, it's kind of like the bar at 2 a.m. It's like you don't, you got to get out of here. And that's when the nausea and the vomiting come in. And so it's maybe a little bit, I think, of the side effect, sort of you're trained from the side effects. But I think also that you have the sense eventually of the increased feeling of fullness that you do learn to listen to your body. And you are, eventually, if you sort of learn to feel full, and that's where I think a lot, once again, it's so important to sort of educate people who are starting this to, listen to those that, because a lot of times, we're a culture that maybe eats in front of the television, and we don't listen to those feelings of fullness. And maybe it's okay just intentionally, take half of the portion that you usually do. Maybe intentionally don't drink while you're, a beverage while you're eating. Maybe intentionally, so be very intentional when you first start on the medication because that gives your body a chance to, tell you, am I full? And then over time, you learn to listen to your body. And that's where that, because you do have an more a sense of fullness sooner. And so if you do learn to listen to those key, the clues that your body's sending you, I think so. To answer your question, it's both. I think it's a little bit of both.
Yeah, absolutely. So some of the, key highlights from what I take from that is to, there is that blind is driving me
I
crazy.
know. I was like,
These
it's just right
these
in your
dots on my
eye.
head. Excuse me while I move. So some of these key points that I'm taking away from what you're saying is, definitely do not focus on higher fat foods. So some of those choices would be lean proteins. Would you even recommend that they consider like having some bland options on hand, like maybe some rice, whole grain toast, and you know,
Yes,
I
yes,
think
yeah,
that even you had mentioned in your article about, and I completely agree with this, when you're dealing with the feeling of fullness coming on really quick, that, consuming those fermentable vegetables, those cruciferous vegetables. So we're looking
yes.
at cabbage, we're looking at broccoli, stuff like that.
Hmm.
That can be maybe a little more difficult too to kind of get down while you're first adjusting as well.
Yes, yes. Those vegetables that typically create more gas.
Mhm.
They, that you may want to stay away from those because they're going to, everything is going to be staying longer in your gut. And so they are going to be taking longer to digest. They're going to be creating more gas. They're going to be filling you up more. And especially while you're trying to get used to, okay, how much do I need to eat and figuring that out, then sort of avoiding those things. Like you said, those cruciferous vegetables, but even things I think I mentioned in the article, like turnips, things that maybe you don't think of if you enjoy turnips. I know not everyone does, but I'm Southern and we eat turnips. But yeah, it's just, anything that if it's something that makes you gassy, if it's going, to be sitting longer in your GI tract, it's going to have longer to produce gas. And so avoiding that while you're kind of getting used to a new style of eating, getting used to your body adjusting to this new medication, it's going to decrease those side effects. Just thinking of giving your body some time and like you said, having some bland options, having, some, and also I talked a lot about um, the choice of beverage. Water is best, and I know a lot of people really struggle with drinking water, which is why there are, I think it was 880 million TikTok views for water talk, which is apparently recipes for water, which I think is just fascinating because it is so many people struggle to drink water. But it is so important because, the carbonation, once again, we're getting to, the carbonation in fizzy drinks can, once again, fill you up, make you feel, increase your nausea, trying to find something to stay hydrated because one of the side effects you can get with Ozempic or is semaglutide is constipation. So staying hydrated can help with the constipation. And, it's so important to kind of, keep hydrated throughout the day. I mean, also, of course, just for your general health, but no one wants to be constipated. Talking about a pain in the butt, but it's, if you can't tolerate water, there's so many different ways. Even if you're a diabetic, there's so many different sugar-free add-ins for water. And so that's, and I know I've had the question before of, will putting something in my water, it's not water anymore. And it's still water. You know,
Right. It's fluid.
it's it's fluid. You know, I think there's a big leap between putting um you know, a flavor packet or a sugar-free, you know, syrup or something in your water and a Mountain Dew, for example. Mother, if you're on here. But you know, there's a huge leap between those two because, you know, the sodas can very much dehydrate you, can lead to, you know, osteoporotic bone changes. I mean, there's just so much that you can get into if your primary form of hydration is nothing but, you know, soda, you know. So that's where, you know, finding a way, and I know I mentioned if you are nauseous, adding something that has a little citric taste to it, you know, a little tartness for a lot of people can help with that too. So it's just those little tidbits can help sometimes just to overcome those side effects.
Yeah, absolutely. You know, everything there. Because I know a lot of people might turn to carbonation kind of as their comfort for when they
Hmm.
are feeling a little nauseous. But, you know, it's really important to remember that when you do drink carbonation, you know, remember your stomach is a muscle. So you're drinking carbonation, your stomach can expand, you can fit more food down when that happens, which is why, you know, as a dietitian, whenever we do, you know, counsel people who've had gastric bypass surgery, we always tell them, you know, do not drink carbonated beverages because of that. You know, it will expand the area down there. We do not want that. But another option could be, in fact, you know, adding ginger. So, you know, ginger tea, ginger flavored water that could help with any sort of nausea that you have and really kind of settle the stomach. Um,
Yeah,
a
I
question
like.
I had when you brought up the, um, you know, osteoporosis, or any sort of, you know, calcium coming from the high caffeine content from drinking the sodas too, made me think about Ozempic and how with the decreased intake, with the decreased food intake, what type of, you know, potential vitamin and mineral deficiencies have been identified, if any, through research studies that you have found?
Well, so with any weight loss program, there's pretty much always going to be a concurrent loss of like lean muscle. That is across the board, I think, for any weight loss program that's studied. So that is where we get into the importance of an exercise program with any weight loss program. It is just it's really though I think it's just you can't understate the importance of a weight loss program and exercise program going hand in hand because you're needing to kind of combine those things. Just it's just because, you know, cutting calories is just one part of kind of a lifestyle change, I think is a big part. But also because whenever you are cutting calories, your body is going to use some of your muscle mass. You know, it's not just going to use the stored fat, it's also going to use some of your stored lean muscle as what it's going to burn. And, you know, because that's essentially at its most basic, you know, when you cut, you know, calories and you're losing weight, you're not just losing fat. You are going to be losing some lean muscle. And so the goal is that by doing some form of resistance exercise, you're maintaining that lean muscle mass. And it is especially important because as we age, we start losing lean muscle mass anyway. It's just another cruel joke as we age, one more thing that just happens. And so it's especially important. And when I say resistance, it doesn't have to be that you are just like, you know, pumping that. It's just it doesn't have to be something crazy because I find sometimes people they kind of overshoot the mark and then they're sore and they're tired and they don't want to exercise So, you start where you are, and if you haven't been exercising at all for 10 years or whatever, 20 years, and, then if resistance can be your body weight, resistance can be you holding onto the back of a chair and, you know, dipping up and down, or literally sitting up and down from a chair 10 times. Your resistance can be your own body weight. Resistance can be you taking a can of soup and lifting it over your head. It doesn't have to start with even a gym membership and some big, I'm pumping iron and I'm, seeing my gains. It's you start where you are and you build from there. um, it's it's the important thing is that it's consistent, and that it's, consistent, and it's the majority of the days a week for at least, 20 to 30 minutes a day. I mean, that's sort of the bare minimum. So 4 days a week, 20, 30 minutes a day, that's what you're looking for. And so that's what you want. And then that's the goal. But as far as, the sort of preventing things from happening, that's, changes in the body, that's kind of what you're going for, is that you don't want the lean muscle to just go away as you're losing weight. So,
Yeah, absolutely. Well, I think that, with all of the attention that these medications have, with all of the people talking about it, I think there is definitely a demand for it. And you've certainly have a lot of experience with that. So cost. Cost is prohibitive to many people who are seeking this out, which, can be a little disheartening when you're hearing about it. You're hearing about it on the internet. You're seeing it, and at the same time, many people are seeing that it's available in these, different places that are not their doctor's office. Like you can go to maybe like a med spa or
online
something like
place,
that
yes.
and get it. Yeah. So,
Yeah.
what is the difference between what you're getting at your doctor's office versus what you're getting at, say, like a med spa? Like, is that the same medication?
Well, right now you're really not. Most people can't get it at any retail pharmacy. It has been on the critical shortage list since, I believe it's been March or May of this year. And so it has just become more and more and more of an issue. And so there's that sort of, you start at a point of the medication is probably not going to be available. It might be available in some strengths at certain pharmacies. To be completely full disclosure, I was on Ozempic for my diabetes for over a year, and I was no longer able to get it. Let's see, in September was when I stopped being able to get it, and had to switch to another medication. And so the problem becomes then, so medication may not be available at a retail pharmacy. And then the other side of that, so Ozempic is indicated for diabetes. So the other side of that is, if you are not diabetic, then a lot of insurance plans don't cover medications at all for weight loss. Medicare, for example, does not cover medications at all that are indicated for weight loss. Um, and I know we've discussed this, but they will cover surgical weight loss procedures,
Right,
but they will cover no weight loss medications. Nor will they
right,
cover your supplements after your
right,
weight loss surgery,
right,
but that's a whole other issue. But even commercial insurance plans, a lot of them will not cover any medications for weight loss. So, so then you have that whole class, you're kind of stuck that you can't get a medication for weight loss. And so, there are some copay coupons from the pharmaceutical companies that would help if the medication was available, and even if your insurance would not pay for any of it. But they do not cover the entire cost of it. So I believe they would bring the cost down to around, say you had no coverage for Wegovy, I believe it brings the cost down to somewhere in the neighborhood of around $500 if you had no insurance coverage with the coupon. To be completely honest, I haven't checked because it's not really available. So it's that's how it is now. So what that sets up is the FDA, the Food and Drug Administration in the United States, has a kind of workaround for drugs that are on a critical shortage list. And they actually say that for drugs that are on a critical shortage list, that compounding pharmacies are allowed to make what they say is copies. They have to, the verbiage in the FDA's guidelines is that these medications have to be essentially copies of the commercially available drugs. And so that's where I think there is a lot of confusion because there is no generic available for semaglutide, for any of the Mounjaro, Ozempic, Wegovy, any of these medications. There is no generic available. However, when you go to, as you mentioned, like the med spas, the things like this, you are getting what is supposed to be essentially a copy per the FDA regulations. And so a compounding pharmacy is a pharmacy that takes a look at the molecule, that semaglutide molecule, and they are supposed to recreate that. And then they are selling you like I said, what is supposed to be essentially a copy. And so it's not the name brand medicine, and it's not generic because generic medications also have to go through a very rigorous quality control sort of vetting process through the FDA, where they have to prove that they have the same bioequivalence and all this kind of thing. Now, that's a great workaround because if it wasn't for the compounding pharmacies, then there are a lot of times we wouldn't have medicines at all during critical drug shortages. But it's concerning, I think, because there have already been instances where people have been sold medications that they thought were semaglutide, but it turned out that it was not semaglutide at all. So I think there was one instance where someone was sold an insulin pen or insulin in and in a pen that they injected themselves and had a really negative outcome. So this is where you have to worry about these individuals, maybe are not operating within, the law. There have also been some instances where some individuals have added a salt onto the semaglutide molecule, which when you get into sort of chemistry, that's not okay to just start messing around with a molecule like that. We know what that semaglutide molecule does, and so that's not essentially a copy. If you start adding, you know, a chloride or a salt molecule, then that's not essentially a copy. And so there have been a lot of warnings coming from the FDA about, the saying like caveat emptor, buyer beware, because that, not all of these compounding pharmacies and not all of these places are operating the way that they should. And so I think that it's a great thing that it's available, because if it wasn't, then no one would be able to get the medication right now. The pharmaceutical company that makes Ozempic and Wegovy, their best guess for when the shortage will be remedied is right now, June, I think, of 2024, which, you know, that's not doing
Wow.
anyone any good. Um, and so, I think right now that's great that this is an option, but I think everyone has to be aware that, okay, this is still a prescription medicine. So, if it sounds too good to be true, it probably is. You still need that kind of bare minimum of, I should be seeing a healthcare provider, even if it's a telehealth visit. You should have a health visit with a provider of some sort. You still do require a prescription. It's a prescription medication. So if someone says that they're going to give you a medicine without a prescription, that's not it. Something is not above board. You should be receiving this from a pharmacy that has a pharmacist available for you to ask questions. There's actually a website that I linked to in my last article, because you can actually look up licensed, make sure that the compounding pharmacy you're receiving this from is a licensed pharmacy. If you can't find them, then once again, that's an issue, because these places should be licensed pharmacies. And if it sounds too good to be true regarding the cost, once again, these medicines cost money. Receiving healthcare does cost money. So if you're receiving the healthcare, the prescription, the medication, and it's at a steeply discounted cost compared to everyone else that you've seen advertising this service, providing this medication, well, that's also suspicious, because everyone wants a deal, but it's not always the best place to find, the deal is with your health. So, once again, do some due diligence, because it may not be that you're getting what you think you're getting.
It's very helpful. I guess to that end, are there any alternatives that could be potentially coming on the market that are comparable to Ozempic and Wegovy?
Yes. So, uh, what I mentioned earlier, Mounjaro, which has been on the market for a while, indicated for diabetes, and it was just approved within the past couple of weeks with the other name for that, or the active ingredient, I should say, is tirzepatide, and it has just been approved, and it will be marketed for weight loss as Zepbound, Zepbound, which another mouthful. And Mounjaro is already on the critical shortage list. So tirzepatide is already being compounded through the compounding pharmacy. So I think once again it will be interesting to see if if it's available. As soon as it hits the market, is it going to be even available at retail pharmacies? How that's going to play out. I think it will be interesting to see how that all works out.
Yeah. Yeah. Do you foresee the insurances getting on board with these weight loss medications anytime soon?
So, I think it's going to be an attitude shift. I think that it has to, do with obesity being accepted as a disease process rather than a personal shortcoming. That there is still, I think, I think a lot of people still think of obesity as, um, an issue with people, well, if they just push back from the table, or just it's a something that has to do with someone just not having the willpower, and that it's not a disease state. And I think that, unfortunately, as with many things in healthcare, if if we can get insurance companies to see how much obesity costs them, I think that's really, unfortunately, a lot of times what it takes. And so I think that if because obesity is so detrimental, that's where we get into that it can certainly it can contribute to so many other health states. And so that's where I think I don't know. I don't think that it's certainly not something insurance companies are going to do out of the goodness of their heart. But I think that if we can get them to maybe acknowledge that, this is something that is going to actually affect your bottom line, in that people are going to be healthier long term and you're not going to have, and I still go back to, I think it's so odd that insurance companies pay for a surgical procedure, hospital stay, that kind of thing, but, won't pay for medications. And I find that odd, and I don't know, but I think maybe it's that whole, um, the fixing things after they're broke maybe kind of mentality that insurance companies have. That's just a huge issue with the American healthcare system in general. So
You're preaching to the choir. I mean, I
I
think I
know they
mentioned
won't
that.
pay. They won't pay for registered dietitians either. So
Yeah,
you know exactly
there's
what I'm
a
talking about.
handful out there. I think you get like a one or two visits a year, but I mean,
Yes.
it's a critical need for sure. And
Yes.
and I'm with you. It is changing the mind frame about just everything related to it. It is something that could dramatically improve the quality of life for individuals if they are able to improve their health. Um, and it's just one of those benefits risks, where the benefits are just so much greater than the actual risk that is there. So yeah, that's that's how
Yeah.
I feel insurance works. I've seen the movie Along Came Polly, so I feel like a benefits risk assessment, that's how that works. But
Yes.
and yeah, and so that really comes to one of my other questions, is Ozempic really meant for kind of like short term? Like, do you set your goal weight? Do you take Ozempic? Do you get to your goal weight and then do you wean off? Um, or are you taking it for an extended period of time?
Well, the studies that have looked at, people who take it for weight loss and then come off of it, if we think of obesity as a disease state, the studies have shown that most people who will take it and then stop taking it are back at their base weight, usually within a year. And you know, that is the thing, is that it's providing that sense of fullness. It's providing, the decreased need to eat, as much. And so when you take away that the physical, need to eat as much, your sort of eating patterns sort of reemerge, is what seems to happen in studies. I would not say that that's an impossibility, but that certainly seems to be the pattern. And I think anecdotally, that seems to be what I hear from people. Um, and this is, even from people who are not, um, like I mentioned earlier, people who are not taking it, maybe who are taking it off label, who aren't with that 27 or 30 BMI, who, are taking it to lose not as much weight, but, you know, they are still taking it a short term, coming off, and then regaining that weight. The thing is, I think of it like any other disease state is where I am. I don't know why it's an expectation of I'm going to take it a short time and then stop the medicine. That's sort of, I think, a kind of strange expectation. But I think that maybe. I would always talk to a medical provider, but there's always options as far as maybe trying to decrease the dose, or maybe, what if it's a cost thing, if it's, what is the goal in coming off the medicine? What is your ultimate goal? Because I think certainly you don't want to end up sort of yo-yoing with your weight. And so that is, I think a discussion that really needs to be had, because the studies seem to indicate, and sort of anecdotally, what I seem to see is that people, in the majority of people, seem to start putting the weight back on after they quit their medication, which is sort of to be expected. There's no physical change that's preventing you from eating the way you used to. And so um, that's that's certainly not unexpected. It's not a failure, and that's the other thing, is that I think it also sets people up for maybe some mental health issues, because they feel as though they are failing, because they're putting the weight back on, and that's just not it at all. It's You're taking a medication for a disease state. It would be as though you felt guilty because your blood pressure went up when you stopped taking your blood pressure medication. You know, but once again, we get into sort of all of the social stigma that goes along with obesity, and so it's difficult.
Right, right, absolutely. Well, I would love to, just ask the audience if they have any questions right now for Dr. Morrissey. Um, this has been a very interesting exploration into Ozempic, and taking a look here. And of course, if you have any comments or questions about the show after it is aired, it will be archived on YouTube at the Foodguides Help YouTube channel, which you can find on foodguides.com. But yeah, this is definitely very interesting conversation that needs to continue with the general public, because it's just a broader situation. We could get into the whole social constructs, the whole built environment, if you will, about how our current system kind of just is built for kind of harboring that mindset, and the 40 plus hour work week, the working household, the having your kids having to be in so many different activities, to get into a good school, and how that leads to convenience foods, etc. I mean,
Oh,
there's a
yes.
lot to it, but all of that, systemic change does not happen overnight and will not happen overnight. No sidewalks, in certain areas, all that stuff.
Mm.
It's just, you know, there are some things that really can help improve the health of the community, and this seems to definitely be one of those things that is helping people. So yeah,
Yes, I think so. I think it
yeah,
definitely can.
if it's available.
If it's available,
If
yeah, if
it's
you can
available.
get access to it, and if that's the big if. So,
Yeah,
like I said,
if
we'll
it,
see if how the shortages pan out over the next 6 to 9 months. That will be interesting to see.
yes, yeah, the shortages, and then also making it economically available for all people. So
Yes,
yeah,
absolutely.
yes, yeah, absolutely. Well, if nobody has any questions, I think we will wrap it up. Do you have anything you'd like to add before we jump off?
I can't think of anything. Thank you for having me. I always enjoy this.
Thank you so much, and we will definitely do this again soon.
All right, talk to
Yay.
you
Thank you
soon.
all for coming.
Bye.
Bye.